Right now, we're going to welcome in a special guest, Dr. Brian Sokalsky from Jersey Shore Sports Medicine. Talk a little PRP. Good morning, Doc.
Hey, Sully, how you doing?
That intro song was specifically for you.
I appreciate that. No better Saturday Night Live skit.
I wanted to kind of let our listening audience in on some stuff that I've been going through. Obviously, you gave me the PRP shots in late January, there, January 19th, I believe it was. So we're about 4 weeks in. First, before we get into the rehab stuff, let our audience know what exactly is PRP and how does it help a guy like myself.
Sure. So PRP stands for platelet-rich plasma. Basically, what we do is we draw the patient's blood, spin it down to concentrate the platelets. The platelets have all the growth factors the body uses to heal an injury. So we use it primarily for chronic tendon injuries and ligament injuries that haven't fully healed. So in your case, Achilles tendinitis that you've had for a number of years, tennis elbow, partial rotator cuff tears. By injecting the platelet-rich plasma into the damaged tissue, we kind of trick the body into thinking it's a brand new injury and concentrate the growth factors to allow the body to heal the tissue properly this time.
Now, Doc, what factors go into chronic tendinitis? Is it more genetics? Is it more overuse, underuse, and then trying to play a sport? You know, as you get older, guys like myself who played high school and college sports, you want to still be active, and you might go from a 40-hour work week and try to play something on the weekends and overextend yourself. What's the biggest factor in terms of creating chronic tendinitis?
Well, you hit on a number of the factors, and there really is no one factor. It's different for every injury and every person, but most commonly it's just overuse and not allowing the tendon time to heal on its own. So particularly you notice things like the Achilles tendon, even if you tweak it in a baseball game on the weekend, you're walking, you're active during the week, so it's not getting the time to heal properly.
Take me back to late January. You saw the X-rays that I got done from Atlantic Medical Imaging. What did that show you, and what was the diagnosis? Obviously it was bad enough to where I needed PRP, but like you were telling me, it wasn't quite as bad as I had initially feared.
Yeah, I mean, considering how long you've been dealing with this, when AMI was kind enough to provide both the X-rays and the MRIs of both ankles, basically what we see is a little bit of thickening of the tendon. So when the tendon's damaged, you get small little tears. It's almost like individual fibers on a rope tearing. And then if it heals properly, everything stays nice and parallel and smooth. When the body heals with scar tissue or fibrotic tissue, everything kind of gets cross-linked and mismatched, and it kind of looks like almost like a woven basket of crosses. And so the tendon tends to thicken because everything's not running as it should be parallel. So we could see that on the MRI that parts of the tendon were thicker than they should be.
So when you initially put the PRP injection, it wasn't that painful. Obviously you numb the area up, and for a couple of days you kind of really can't do a whole lot. But then after that, it didn't feel. There didn't seem to be a real initial after effect of that. What happens in the first couple of days as you inject the PRP, the platelet-rich plasma, directly into the tendon? What's going on there to sort of stimulate the healing?
Yeah, so in those first few days, all those platelets that we've concentrated and injected in are releasing all the growth factors. And so the body goes through an initial burst of inflammation, and inflammation generally has a negative connotation to it, but really the inflammation is the way our body heals all injuries. So it goes through a burst of good inflammation and brings in a whole lot more inflammatory mediators to trigger this healing response. So everything the body needs to heal, it's kind of collecting and bringing to the area. And so all of that creates a lot of stiffness and a little bit of swelling. And that's why the first few days you can't do much because you've got all that stuff in the area. And then over the next week or two, the healing process starts. So now it's just like you have a brand new injury. So just like any other injury, it takes a few weeks for it to properly heal. So it takes time for you to see that significant improvement in pain and function. function.
We're talking with Dr. Brian Sokalsky from Jersey Shore Sports Medicine in Summers Point, talking about PRP injections and healing chronic tendinitis. And, Doc, one thing that kind of struck me as you were explaining this whole process to me was the body sort of kind of gave up on healing that injury. What did you mean by that, and how what's the word? How often does that happen where the body says, we're just not dealing with this injury anymore? What's the physiology of that?
Yeah, so I mean, that's a great question, and we're still trying to figure out the specifics of it. But basically, like I said, inflammation is the body's way of healing. So we'll continue using the Achilles tendon as an example. You tweak the Achilles tendon, or more frequently with runners, you run every day or every other day, and the tissue heals so that when you exercise or when you play a sport, the tissue breaks down and then rebuilds itself. And usually when it rebuilds itself stronger. But if you're constantly causing the tissue to break down, if you're constantly using the Achilles tendon, you play sports on the weekend, but then you work construction during the week, or you've got a job you deliver for UPS or a postman. You're constantly breaking down the tissue because you're constantly using it. The body can't keep up to heal. So eventually what it does is it just lays down this fibrotic scar tissue that we always talk about instead of good, healthy tendon or ligament. And then it kind of moves on to other projects in the body. It just, over time, for some people, it can be 2 months, 3 months, sometimes it's 6 months, but eventually that constant pain goes away and you're just left with kind of like what you had. Day to day, you're okay. The tendon's healed enough that day to day you're okay, but the minute you try to run or the minute you try to do anything athletic, it tightens up on you and you get the pain at that point.
So, Doc, what's the next step for me? I'm about 3-4 weeks into the rehab process with Dr. Ryan Bucaferni over at Integrity Physical Therapy in Northfield. So most of the first 3 weeks have just been very kind of easy blood flow restriction therapy and some gentle stretching, that kind of thing. I assume in the next 2 to 3 weeks here, we're going to start to ramp things up.
Yeah, definitely. I mean, you said we did the procedures on the 19th, so we're about 5 weeks out at this point. So we're really going to start working on building some strength in your calves and in the tendons themselves. More aggressive stretching. I know your primary complaint when you came to see me was a lot of stiffness. So the muscles in the calf and also your plantar fascia at the bottom of your foot. We really need to stretch those things out. So now Ryan will get in there and do more aggressive soft tissue work. He's got that metal tool, that grasping tool the scraper that really digs in there and really loosens things up, and then more aggressive strengthening.
He tore me up pretty good with the scraper the other day. So
okay, so he has started with that. Good. Yeah, it's uncomfortable. I don't want to scare any of your listeners. It actually felt good. But it's very effective, and you feel great when it's done.
Yeah, I could definitely feel it the next day. I was like, "Whoa, man, he scraped me pretty good."
Yeah, but now we got to loosen you up and build a lot of strength and get you ready for the spring season.
So, you said it's about an 8 to 10 week rehab process. So we're looking at probably most of March continuing the rehab. What happens at that point after 10 weeks? What's sort of the next step in getting back to 100% or as close as I can get to that?
Yeah, so once we hit that 10 to 12 week mark, for the most part, the majority of the effects we're going to see with the treatment are complete. Now it becomes on you to continue progressing. So that's continuing with the stretching program on a daily basis, continuing to build strength in your legs. We start looking at a broader general conditioning program for the entire body, not just the legs. For a lot of patients that have been unable to work out because of their injuries, working on weight loss program to kind of take some of the stress off the legs, and particularly the Achilles tendons in your case. So it's more of a general looking at the whole big picture, whole body treatment moving forward.
We're talking with Dr. Brian Sokalsky from Jersey Shore Sports Medicine in Summers Point. And, Doc, how much success have you had with the PRP? I know you've been doing this for about a decade now, so it's something you believe in. I've had some fans of Glory Days kind of reach out to me and say, hey, let me know how that's going, because it's something I've thought about in terms of dealing with a chronic tendon issue. What kind of success rate have you had with this, and why has it been so effective for what you do?
So I've actually had amazing success with it. I've had a number of patients that I was kind of skeptical, and I just kind of told them, look, it's worth a try. I'll put 50-50, 60-40, whether or not it's going to work for you for various reasons. Maybe they're not the healthiest of people. Maybe they're significantly overweight. Maybe they don't have that exercising background, so getting them to go through the rehab part of it is questionable. So even those patients that I was somewhat skeptical with have, for the most part, I'd probably say 80% of my patients have significant pain relief. And in my practice, being sports medicine, a lot of the patients, by the time they come to me, they can't do the activity they want to do. With the Achilles tendon, it's runners. With tennis elbow, golfer's elbow, it's just those sports, tennis and golf. I have partial rotator cuff tears. Dads can't even have a baseball catch with their kids. So being able to get them back to the activities that they enjoy has really been a remarkable experience, and it fits in with my practice perfectly. And the best part is no surgery, none of the risks and none of the costs and none of the time out of work that surgery typically involves.
Doc, real quick before we let you go, how much of it is the patient saying, okay, I've got to attack this rehab, I got to be dedicated with the rehab? I mean, as a doctor, there's only so much you can do, obviously, and how do you get your patients motivated to say, hey, look, if you do these steps in the rehab, you're going to feel a lot better, a lot different. If you don't, you're kind of wasting your time.
Yeah, I'm up front with them in the beginning, so they know, eyes wide open going in, this is going to be a 12-week process. This is going to involve their commitment to doing the therapy, not just in physical therapy, but doing the exercises on their own. So for my athletes, that's not really a difficult conversation. They're motivated on their own to get back to their activities. Some of the less active patients, it's constant motivation, it's constant conversations. There are follow-up visits every couple weeks so that I can keep a closer eye on them. But in the end, it's really up to them to make that commitment. And quite frankly, a lot of times they're committed just by going through the procedure. A lot of people don't like needles, don't like shots. And this is an out-of-pocket cost. So if people are going to commit the money to it, they're going to want to get their full money's worth.
Have you gotten a second doctorate in psychology with all you've had to deal with as a sports doctor?
Sometimes it feels like it. So I love my athletes, but they can be a challenge to work with. But it's a lot of fun.
Great stuff. We appreciate it, Doc. Before we let you go, tell our listening audience how they can get in touch with you if they want to find out more about not only PRP but anything else you can do for them to get them back on track.
Yeah, we offer treatment for all orthopedic injuries, all non-surgical treatments. They can check out the services we offer at our website, JerseyShoreSportsMedicine.com. They can follow us on Facebook at Jersey Shore Sports Medicine and on Twitter at Jersey Shore SM. If they want to make an appointment, they can call the office at 609-904-2565.
Great stuff, Doc. We appreciate it. I know you got to run. You got a busy weekend ahead of you, but thanks for taking a few minutes and letting our audience know about PRP, and we'll obviously keep them up to date with some more videos.
Thanks for having me, Sully. Always great to be on.
Appreciate it, man. Have a good weekend.
You too.